Hello, good morning. I'm Meg O'Lean, Program Manager with the Santa Clara County Behavioral Health Services Department. And we apologize in advance for the noise, background noise you can hear with the construction today. We have taken off our face coverings to better allow our American Sign Language translators to understand the conversation. But the public is encouraged to continue keeping your face coverings on whenever you're conducting essential activities outside the home. To date, there have been 4,370 cases of COVID-19 in Santa Clara County, 156 deaths, and happy to report there have been 0 new deaths from COVID-19. And today we're going to be addressing the opioid fentanyl crisis that's happening within the crisis of COVID-19 in the country and in our county as well. And I have here 2 panelists from the Behavioral Health Services Department's Substance Use Treatment Services, Myra Parwiz, Division Director for Medication Assisted Treatment Programs, and Stephanie Kitchen, Substance Use Prevention Program Manager. So welcome to you both.
Thank you.
And Myra, can you get us started by shedding some light on the opioid epidemic?
Sure. Thank you for bringing light to this important topic. It's important that we note that we have a national epidemic going on inside this pandemic. As most of you might have experienced it personally or know friends or family members. But this epidemic is alive, and it was alive before this pandemic came along upon us. We've been in crisis, opioid crisis, going back to 2013 and 14. As many of you may know, there's been declared a national crisis in our country. And recently, in the last, this year alone, we have seen a surge in opioid overdoses in our country. As of today, Washington Post reported that we had 18% jump in overdoses in month of March. And then in April, it jumped to 29%, and May it jumped to 42%. So as you can see, it is jumping every month, and it's taking lives every day. In 2018-19, the average loss on a daily basis was 128 people per day. So this is going up every day. And it's important that note, and we have this crisis in Santa Clara County as well. In 2018, we lost 66 persons in overdoses, and in 2019, we lost 89. And less than half a year now, we're in only 6 months of this year when we have lost 45. So it's continuing to rise, and it's important to know that what is happening in nationally and also locally, because it's affecting everyone in our society.
So Myra, thank you for sharing those numbers. Could you share a little bit more about what we are experiencing in County of Santa Clara? And do you think that this rise in deaths is related to COVID-19 and shelter in place?
Yes, definitely. The rise has been due to shelter in place for mainly 3 reasons. One, anxiety and depression. So people using alone. So there's nobody next to them to call 911, and also to provide Narcan to them. Narcan is a drug that reverses overdose. And also the economic crisis have played a role here, depression and anxiety, and loss of connection to drug dealers has been another cause for it, because the borders are closed, so people are reaching out to other unknown sources. Maybe their known sources have dried up, so they're not they don't know what they're using when they're buying off the street. In Santa Clara County in particular, we're seeing a crisis related to fentanyl. We have had 19 deaths as of May 8, specifically related to fentanyl. Fentanyl is a synthetic opioid, and it's very potent. It's like 50 to 100% more potent than morphine. So a very small amount of it can take your life away. And Santa Clara County in particular, we're seeing it on the streets, people using fake pills as Oxycontin. And the fake pills kind of look in the streets, they come in a blue color, white color, a different color. It looks like this. It has an M shape and it has like 30 milligram. You're thinking it's real, but it's not. Often it's not, and it's laced with fentanyl. So it can take your life away very, very quickly. And just a comparison, the fentanyl crisis, last year, comparing the data from January of 2019 to May of 2019, we have only had 7 losses due to fentanyl. This year, that has tripled, so we're almost at 20. So that's the crisis that we're currently seeing in Santa Clara County.
Well, I'm really glad we have the opportunity today to talk to the public about this crisis. Stephanie, what are some other ways that our department is getting the word out about this issue?
Well, first, thank you, Mego. So under Substance Use Prevention Services, we have several strategies that we use to kind of get messaging out to the public through education and outreach. And so, first of all, most people want to know, how do we reach the youth? And we have service providers that we make sure we get information to them and feed them the latest research. And for that research, we distribute it to the schools, whether it is after-school programs, summer camps, arts and sports groups, and community groups. And for our young adults, we have a relationship, we have an actual collaborative with the colleges. And so we serve 7 community colleges, 2 universities that we get information out to their student centers and their wellness centers. And for adults, we make sure that we hit our parent groups that we already work with, and for other different family events that we have in the community. We would have a program for older adults, and that's specifically for adults 55 and older, in which we do a lot of focus on medication, prescription drugs, being able to recognize what's real and what's not real, and how they're mixing their prescription drugs. And also for adults and for professionals, we have a specific program training that we do. So we make sure that professionals, whether they're nurses in clinics or folks in the community doing work, we make sure they have up-to-date information to pass down to whoever their clients and their patients are. We also do community media awareness campaigns. Those awareness campaigns, we've had one just before COVID-19 that we did that was specifically for opioids. And we do a lot of print materials that we get out and just distribute that. But we also do digital advertising. We're hitting a lot of the other social media platforms as well. So those are some of the ways that we get information out.
Public education efforts. Has COVID-19 affected your community outreach?
Absolutely. One of the things that we've had to all do is we've had to switch over to using technology and understanding the different platforms that are out there. That's been a little trial and error, but I will tell you, a lot of our service providers have done really creative things with that. They're using the different platforms beyond Zoom and Blue Jeans, but they're hitting TikTok and Instagram, and of course, Facebook as well, with a lot of the advertising and a lot of the messages. I would also say that they've been creative in creating a lot of online. For instance, we have an online creative art workshop that's going on. We fund a culinary arts program, and with that culinary arts program, they're now doing it online, in which they're sent all of the recipes and all of the things that they need. And then so the chef is actually walking them through live through Zoom and preparing things. So a lot of these programs have been really creative. And for all these programs, even the culinary arts, there's information that's infused into these programs to make sure these young people get this message and understand what are the latest trends and what's going on. Now, there have been some challenges, and some of those challenges have been particularly in a lot of the unincorporated areas where there's weak or no internet access. We've had issues where getting kids and other adults as well devices. We know most people have phones, but then we also have to make sure whether the connection is good. And so these are challenges we'll continue to work with, but those are ways in which we've had to really kind of change the way we provide services. I will say that we've been able to meet and reach more young people, more parents by using technology. Let's say in the past we've done groups where we've only hit 15 kids. Now we're hitting 25 and 30 each time that we're actually doing different events. So it has increased our ability to get these messages out.
That's great that your prevention efforts have been able to continue in spite of the pandemic and even reach more people than before. So Myra, if somebody in the community is struggling with opioid addiction, what kind of treatment and resources are available for them?
Yes, in Santa Clara County, we're lucky to have access to medication-assisted treatment programs. In the county, we have particularly 3 substance use medication-assisted treatment programs that are located throughout the county. One is on VMC campus, one is on the east side of the county, and one is on the south side of the county. Aside from that, medication-assisted treatment programs are also available through VMC emergency room and through inpatient hospital. Our inpatient units can also start someone on medication-assisted treatment program and primary care sites. Medication-assisted treatment program for addiction consists of primarily 3 drugs, which are methadone, buprenorphine or Suboxone, and naltrexone or Vivitrol. Those are the 3 FDA-approved drugs that's available for treatment of addiction, and they're very effective. So I encourage anybody that's struggling with addiction to please seek help. We are here to help. You can go as easy as step into VMC emergency room, and you can get started in Suboxone treatment. You can contact your primary care and discuss the options, or you can call directly the substance use call-in center, the SUT's gateway number, which is 1-800-488-9919, and get connected to any of the treatment programs. In addition to that, we also offer Narcan. Narcan is a drug that reverses overdose, and Narcan is really important to have if you're using any substance use, just to stay safe, basically, from overdosing. And that is available in form of injection, or in terms of you can use as a nasal spray. In Santa Clara County treatment programs, we offer the nasal Narcan, and you can stop at any of the county sites, the medication-assisted treatment program sites, to get a free Narcan training and a free kit. Those are the resources available in Santa Clara County for residents.
Great. And Stephanie, if a family member or a parent just wants to get more information, where can they go?
Well, aside from our behavioral health services, also has a site on our website is Substance Use Prevention Services. You'll find information on all drugs, but if you want specific information on opioids, you can go to the website www.opioidstakeyou.org.
Thank you both for your time today. We just want to make sure to leave you with some of these important resources. Again, as Myra mentioned, to access substance use treatment services, including the medication-assisted treatment, you can call 1-800-488-9919. There's also a youth direct intake line, which is 408-272-6518. For a list of sites with free Narcan, you can go to www.sccgov.org/SCCOOPP. And finally, for more information about COVID-19 in the county, go to www.sccgov.org/coronavirus. So all of this information will be added to this Facebook post afterwards for you to access. And we want to thank you for watching today and encourage you to please continue to shelter in place while practicing social distancing. Right after this, there is going to be a Facebook Live in Spanish right after this broadcast. This will be taking place here and on the Spanish Public Health website. So we hope you join us for that as well. Thank you so much.